Thank you very much, Mel. Good morning, everyone. Good morning, everyone. Good morning. Thank you. Thank you. Thank you very much. Thank you. After this eloquent presentation, which reflects not only Kenya's challenges, but Africa's challenges, there's really little we can add. But I guess invitations to us all is to share experiences from our own quarters. And I'll try to be as brief as possible so that later on we have time for interaction. I wanted to start by thanking Professor Will Ngwa for inviting us and for organizing this event. My Minister of Health was invited and she was supposed to be here. And she has asked me to convey her sincere apologies that she cannot come here. As you know, we have had these cyclones that have caused an additional health problem in the country, and she has to take care of that with her colleagues and partners. But she did ask me to convey some messages that she would have conveyed if she were here. So without being a medical doctor, I would mention some of the things that constitute challenges and activities in the health sector in Mozambique. But before I do that, let me say that we are so thankful, the people and government of Mozambique, to the international community who came to help Mozambique, to help Mozambicans when this natural disaster struck. Cyclone Idai affected and Kenneth after that, affected 1.7 million people. It destroyed 106 health units, including hospitals. 644 people died in the disaster. And initial estimates of the costs for recovery, for reconstruction, in the order of $3.2 billion, 230 million of which would be for the health sector alone. We therefore seek your assistance in going the next phase of recovery and reconstruction. And we want to make sure that we normalize as soon as possible the life of the people affected. The government is organizing a conference at the end of this month on the 31st of May and 1st of June in Beira itself, the city that was destroyed. 90% of it was destroyed. And international partners, including the UN, the World Bank, WHO, and other organizations and individuals will go to that city to look at what the government has prepared in terms of reconstruction plans, and also we'll have experts who will talk about how best to go about this. And I know this institution of higher learning and center of excellence can be of great use, even if you're not going to the conference, but if you can later on send people help with your expertise, it would be much appreciated. Now, coming back to the theme of this conference, Mozambique is undergoing a demographic and epidemiologic transition, which is a result of an increase in non-communicable diseases. Diabetes, cardiovascular diseases, cancer, and chronic respiratory diseases are growing exponentially due to greater exposure to risk. I will not bore you with the numbers, the statistics about these, but just high blood pressure, to give you an idea, is growing at 34.9% per annum. This is serious. But we also have problems with high alcohol and tobacco consumption and lack of physical exercise. Now, what is the government doing? The Ministry of Health started by establishing many years ago a dedicated department on non-communicable diseases. And a national program was adopted for prevention and control. And there is a specific concentration on cervical and breast cancer, because this is a serious national health problem in the country. We are also wanting to introduce the HPV vaccine, which helps with the prevention of cervical cancer. And we are also building institutional and human capacity. We are joining international organizations and treaties on the control of risk factors, like the Framework Convention on Tobacco Control. We are also putting a lot of emphasis on educating communities, because we think this is essential for prevention and control. One important point that I would think is essential when we speak about cultural barriers and things like that in Africa, one important point I would emphasize is political will first from government leaders, and action to educate the people and the communities. The First Lady of Mozambique has taken on that challenge, and she has been working with the Minister of Health and our international partners to mobilize people and partnerships. There are still challenges, difficulties in conducting an effective prevention and control, and here we're seeking partners, we're looking for partners. We also deal with intersectoral coordination and cooperation within Mozambique and with international partners. We seek to have monitoring and evaluation systems that can be more helpful, and here we look for partners as well. And we also find that donors and international partners that help the health sector in Africa don't put as much emphasis on non-communicable diseases as they put on the other diseases. And here I must say that we have excellent cooperation with the United States through USAID, CDC, PEPFAR, and a lot is being done over there. But then these challenges in health also have to do with development, because as we develop our economies, as we have economic growth, we will be able to generate the resources that we need to do what we need to do in health. And here I wanted to tell a good story about Mozambique. The cyclones notwithstanding, the economy of Mozambique has been growing steadily. We had serious issues from 2015 up to now, but we are now in the process of recovery. We are going to host from the 18th to the 21st of June in Mozambique the US-Africa Business Summit. And you will have about 11 or more heads of state from Africa, US government representatives, and CEOs from Africa, across Africa, CEOs from the United States. And we are talking about large companies, medium-sized and small-sized companies. And we're looking for partnerships that will help to build the economies of Africa and create sustainability so that we can address the issues of health, education, and other challenges. Of course, you know that we discover natural gas of large proportions, and we have all the oil majors flocking into Mozambique. This will help also generate resources for the country and to be able to put more resources into health. For those who don't know, Mozambique is a large country, twice the size of California. We are 30 million people, but in terms of market, Southern Africa is more than 300 million people. And if you look at the continent of Africa, we are many more, and by 2050 we will be more than 2 billion. So I wanted to share this with you and to leave with you an open invitation to visit Mozambique, to collaborate with us, but also to do some tourism. And thank you very much for your attention.